Hello friends, welcome back to my channel Concepts in Community Medicine. So we are going to discuss all the color codings in community medicine for the next 1 week. So let's get started with the first one. Today let's first discuss about the STI or the sexually transmitted infections color coded kits. The National AIDS Control Organization is providing these STI or RTI kits free of cost in all the designated STI clinics. We have a total of 7 kits. This is the broad overview of all the kits. Kit number 1 is the grey kit. Kit number 2 is the green kit. Kits number 1 and 2 are meant for discharge. Kit number 3, which is a white kit, 4 is a blue kit and 5 is a red kit. So 3, 4 and 5 are meant for genital ulcer. Kit number 6 is a yellow kit and it is meant for lower abdominal pain. Kit number 7 is a black kit and it is meant for inguinal bubo. As discussed earlier, kits number 1 and 2 are meant for discharge. Kit number 1, the grey kit, is meant for urethral, anorectal and cervical discharge, and the kit number 2, green kit, is meant for vaginal discharge. So kits number 3, 4 and 5 are for genital ulcers. Under genital ulcers, we have two categories, non-herpetic and herpetic genital ulcer. And non-herpetic genital ulcers are further divided into non-allergic and allergic to penicillin. So kit number 3 or the white kit is meant for non-herpetic genital ulcers which are not allergic to penicillin, and kit number 4 blue kit are meant for non-herpetic genital ulcers which are allergic to penicillin, and kit number 5 red kit is meant for herpetic genital ulcers. Now let's discuss the drugs or the contents included in the kits. All the kits contain antibiotics except for kit number 2 and 5. Kit number 2, which is the green kit meant for vaginal discharge, contains antifungal drugs. Kit number 5, which is meant for genital herpetic ulcers, contains antiviral drugs. It is the red kit. All the other remaining kits, kit number 1, 3, 4, 6 and 7 contains antibiotics, out of which the kit number 6, which is the yellow kit meant for lower abdominal pain, does not include azithromycin, whereas the remaining kits 1, 3, 4 and 7 contains azithromycin as one of the antibiotic. Now you can have an overview of whatever was discussed in the previous slides. Kit 1, the grey kit meant for urethral, anorectal, cervical discharge. It contains azithromycin, cefixime. Kit number 2, the green kit meant for vaginal discharge, includes antifungal drugs like secnidazole and fluconazole. Kit number 3, white kit, which is meant for non-herpetic genital ulcer, which is non-allergic to penicillin. So the drugs included will be penicillin and azithromycin. And kit number 4, which is the blue kit meant for non-herpetic genital ulcers which are allergic to penicillin. So there is no penicillin. It includes azithromycin and doxycycline. Kit number 5, red kit, is meant for herpetic genital ulcer and includes antiviral drugs like acyclovir. Kit number 6, the yellow kit meant for lower abdominal pain, includes drugs like cefixime, metronidazole and doxycycline. So this is that kit which doesn't include azithromycin. Kit number 7, black kit meant for inguinal bubo. It includes azithromycin and doxycycline. So that's it for the STI color coded kits. We'll be discussing all the other remaining color codings in community medicine in the upcoming days. If you find these videos interesting and useful, please do consider subscribing to my channel and share it with your friends who might find it useful, and comment below for more such videos. Thank you.